I will start this off with, I hate public speaking. I hate it so much. But they keep asking me to do these things over and over again. So, can everybody hear me okay? Yeah. All right, so I'm a wellness specialist here at the Pride Center, but I will rewind a little bit and let everybody know about 2022. At the time I was unhoused. I had been living with HIV since 2007. And when COVID happened, I got scared of taking my meds because that would mean I had to leave the house and go out to the hospitals, and I stopped taking my meds. And so it became apparent in the news that monkeypox was going to be a thing. It was in the news. It had started in about May of 2022. So come the first vaccines that were becoming readily available, I went out and I looked for the vaccine. I came here to the AHF, this building right at the front, and it was turned away. They had run out of vaccines. And so I waited a couple more weeks. And did I mess this up? I messed this up. I waited a couple more weeks, and the community center here at the Pride Center, in the community room, they were offering a rapid health fair to get rapid vaccines that day. I got my first vaccine. That's what I thought it'd be. Okay, come back in a couple weeks and I'd be able to get the second one. Well, about 7 days into the first vaccine, I had, so I don't know if this keeps coming again. I had the first stages of some bumps. Some on my hand, and then in my groin and genitalia area. I offered to bring pictures. They told me do not. But it erupted practically overnight, and it was very painful. And it basically looked like a honeycomb structure on each side of my groin. And I developed cellulitis underneath that as well. So I became immobilized practically overnight. I couldn't walk. It was extremely painful. I went to the emergency room, and they said, well, it might be that. And it was a Saturday, so they took the swabs and they sent that off to the health department. And then they went and waited. And they admitted me to the hospital because it was pretty painful. And so what I had to do then was wait. And then the test came back positive. It took several days. And then I had to wait for the health department to bring the medication, which was T-Pox. That's a smallpox medication that they can use to treat this as well. And so by the time I started medication, it was almost a full week. I spent 12 days in the hospital, isolated, alone. Nobody could come visit me. I couldn't, the nurses had a gown up, put on masks, shields, everything, even to come bring me my food. Sometimes the nurses and the nurses' aides would leave it out in the hallway because they didn't want to come bother me. They didn't want to come interact with me. And I was in there 12 days just unsure, waiting for the doctor to come in. Finally, I was allowed to leave because I was contagious. If there are lesions on your body, you are contagious for the entire time until it scabs over and those scabs fall off. So afterwards, when I left the hospital, I told some people about it. I'm not sure how I got it. You can get monkeypox from respiratory, from the air. You can get it from contact, from skin to skin. It's presented as a sexually transmitted infection in a lot of people in the gay community. However, it can also be from bedding, sheets, towels. I was unhoused at the time, so I was couch surfing, living on other people's good charity. And so when it came out that I had monkeypox, a lot of people were like, ew, gross. And you know, that makes you feel real good about yourself. You're like, I don't have it anymore. But what was a thing that I had to deal with was I had actually found a place to move to. And I lost that place because that guy said, I don't want somebody who's potentially bringing infectious diseases into the house. So there I was back out on the street again. And so there was a lot of isolation and loneliness and things. So specifically with why my infection was so severe was because I was off my meds. And it didn't dawn on to me that my lowered T cell count at the time was going to be impactful on other opportunistic infections. Like there's the ones out there we know about, like Kaposi sarcoma and fungal infections and thrush and pneumonia and things like that. But it didn't dawn on me that something could populate so quickly and impact me so much, so quickly that it was debilitating, that I couldn't walk, I couldn't do anything. I just had to go to the hospital and be in pain. And let me tell you, it was painful. So the scars, I didn't really get any residual scarring on my skin. I did get some underneath the skin. And so I could definitely tell that there is some scar tissue built up under there. And that's not painful, it's just kind of uncomfortable. But I will say, I recommend getting your vaccinations when they're come about. Even if you get the first one, it is not a guarantee that you're going to be safe from the infection, because I'm walking proof of that. But now I work here at the Pride Center, and I can work with people and talk to them one-on-one about different vaccines like Mpox, or we can talk about PrEP or post-exposure prophylaxis, things that we can do to help prevent debilitating diseases such as monkeypox or HIV. So I thank you for letting me share this. That's all I know what to say.
So just as takeaways, Josh, if you had 3 takeaways, it sounds like one might be staying on your HIV meds as much as possible.
Yeah. It could be anything overnight. Yeah.
Very quick.
Take it down.
Right. And then get your vaccines if you can. And can you talk a little bit more, if you can, about the stigma, about how that was presented to you, about like just stay away, because you're living with HIV. I have to imagine you've experienced some of that also with that. What was that like for you with the Mpox?
Specifically with Mpox, it was, are you still contagious, was the first question out of everybody's mouth. As long as I had no scars, or I'm sorry, scabs, then I was not contagious. But there was that fear in the back of the head, like, what if? Because a lot of people didn't know, is it gonna come back again? Can you get it again? There was a lot of misconception and fear about that. When I had the lesions, I was basically in the hospital the entire time. But before that, I just thought they were kind of itchy red bumps, that I had irritated them. I thought it might be a herpes outbreak, wasn't sure. But at the time, when I told people why I had been in the hospital, a lot of people were like, just kind of standoffish. I lost a lot of contacts. People just had assumed that I was just doing the wrong thing. And I had curbed my behaviors, actually. I knew this was out in the community, and I took a step back from having sex during that time. A lot of people did. And in those decisions with what I experienced, again, like being in the hospital, it was just isolating, alone. I just felt dirty, I felt unclean. And that really mirrored back to my HIV status, my diagnosis. I was diagnosed in Texas in 2007. And I was 21 years old, and I didn't know anybody that had HIV, especially anybody my age. And so feeling like isolated, alone, couldn't tell anybody, that definitely mirrored that, especially in looking back at being in hospital and being unable to just have contact with nurses or anybody. Like, nobody wanted to come in the room. Nobody wanted to come bring me food. I had to go run into the hallway so nobody could see me and grab the food tray to come back in. That's kind of crazy. Like, we know that if you're gowned up, you're gonna be fine, but like, people just got tired of gowning up. People got tired of all the precautions they went through, so they just kind of like got fatigued and left me alone. So, and the same thing with friends and people that I knew, they distanced themselves from me. They didn't want to be a part of it. It was too much trouble. It was too impactful to their life. And it was nothing to do with them. It had everything to do with me, but they didn't want any part of it. So I think that's your question.
Thank you. I appreciate you sharing your story with everybody. So I want to start out with a question for Dr. Gorencik. Dr. Gorencik, can you just speak generally? What are the benefits of vaccines for our personal and community health?
I wanted to say that I've always been very passionate about vaccines because they have impacted the lives of millions of people across the world. Because of vaccines, we don't see children dying from disseminated Haemophilus infection. When I was doing my pediatric medicine residency, it was every pediatric ward always had a couple cases of children with meningitis, either for Haemophilus, influenza B, or pneumococcus. These are diseases we don't see anymore because vaccines came out and they are now prevented. Same thing with whooping cough, without the tetanus, diphtheria, pertussis vaccine, we used to see babies dying from whooping cough. My own history, my grandfather on my mother's side, this was before I was born obviously, but he worked at a logging camp in Italy and he was a foreman, and one morning logs fell on his foot and injured him. He ended up in the hospital and he died from tetanus. We don't see tetanus anymore because we have vaccines. And for tetanus, that's a horrible way to die. It's called lockjaw. People get into spasm and he died a very horrible death. And my mother remembers going to the hospital to say goodbye to him when he was dying. So these are things that we don't see anymore and people forget. And I just wanted to share with you some statistics. This is a page that I think just tells you, this was back in 2019, the CDC put out an estimate. Among children born between 1994 to 2018, vaccines have prevented over 400 million illnesses, 27 million hospitalizations, almost 1 million early deaths in children over the course of their lifetimes, and economically saving over 400 billion in direct costs and 1.9 trillion in society costs. So we forget, people are so anti-vaccine today, but they forget that vaccines save children from dying. Children with diseases are severely impacted. They don't develop normally. If you have meningitis, you end up with hearing deficits, neurologic deficits. We don't see it anymore. When I did my pediatric ID residency, I had the opportunity to spend some time in Dallas, Texas with Dr. McCracken, who was one of the pediatric ID gurus of our time. And he was working on that time in studies to look at giving steroids to children with meningitis right before the antibiotic to see if it would decrease the bad outcomes they had, especially hearing loss and neurologic. He did prove that, and they started adopting that, but then shortly around that time, the Haemophilus influenza B conjugated vaccine was developed. We do not see Haemophilus B influenza anymore. We don't see children dying from meningitis, epiglottitis, septic arthritis, they get joints infected. This has really made a tremendous impact in the lives of children across the world. We don't see people dying from smallpox and polio, which devastated whole generations of people. And I wanted to address one question on here. I don't know who this came from, but what if I just get the disease and that will give me immunity and avoid all the side effects of the vaccine? But you forget vaccines were developed so you don't die from the disease or get a horrible outcome or get significant mortality and morbidity that affects the rest of your life. You don't end up having hearing deficits or meningitis. So the COVID vaccine, for instance, it was developed because people were dying from COVID. This was a pandemic. Human beings had not been exposed to a virus like this, so nobody had any immunity. As you know, those first years, people were dying from it, and there was nothing we could do. Those were the most difficult times in my life as a physician in the hospital, seeing patients coming in with COVID, and they were dying because there wasn't hardly anything we could do. We tried different drugs at the beginning. When the COVID vaccine came out, it significantly decreased the dying from COVID. The summer of Delta, our whole floor at Holy Cross, the second floor, was filled with patients with COVID. They were 40, 50 years old, and they hadn't been vaccinated. The vaccine came around, and some people, of course, were nervous and hesitant, didn't want to get it. Well, that year we saw almost everybody in the hospital that had COVID really bad and was on oxygen had not been vaccinated, and most of them died. So I, for myself, have seen what a difference the COVID vaccine has made, because we didn't have anything at the beginning. It's gotten better now as time evolves and people develop immunity. You have people who have COVID who have the vaccine. There's protection in the community, so the vaccine or the COVID is not as deadly. But without the vaccine, we would have continued to see people dying from this. And it was really, I was incredibly grateful that we got the vaccine so quickly. So I think for people who don't believe in vaccines, I've seen what a difference they make. I can reassure you.
Thank you. The next question I want to throw out is to Louis. We talk about vaccines, and the question for Louis is, can you talk a bit about how safe and effective vaccines, what's the process or systems in existence to approve vaccines in the US and keep them safe? And also, along with that, are COVID vaccines fully approved now? and that we can open that up. But really the process, we talk about vaccines, how do we know they're safe? What's the process that's used to get them to market?
So that's a great question. Can you all hear me?
Yeah.
All right. Well, I want to say first and foremost, thank you so much for allowing me to be a part of this event. I'm honored and I feel very privileged to be able to talk to you all about my work at the HIV Vaccine Trials Network and about vaccines in general. So, as alluded to by the other speaker, vaccines have had a tremendous impact on public health throughout the past decades, I would say probably 100 years or so. They've been they have single-handedly reshaped our world and eliminated the disease that once, maimed and killed a lot of people, particularly those most vulnerable in our populations, particularly children and elderly folks or folks with health conditions. So it's crucial to understand that vaccines go through a rigorous approval process. So they go through laboratory testing after it is seen that usually using human tissue and cells, once it is seen that there is a good response or that vaccines could be safe, they typically move into clinical trials. In clinical trials, they go through 3 phases of clinical trials. They go through phase 1, phase 2, and phase 3. Only after those 3 phases of clinical trials does the FDA then, or a submission can be made to the FDA to seek approval for a vaccine. And the FDA really scrutinizes vaccines and vaccine development. And so a vaccine has to show that it is not only capable, meaning that it is effective at preventing or slowing the progression of disease, but it has to show that the risk of taking this vaccine, if there is any, outweighs the risk of actually having the disease. And overwhelmingly that we find that being the case, because most of the side effects of vaccines just in general tends to be redness and swelling, things of that nature at the injection site. Afterwards, it tends to be things like fever, nausea, can be a little upset stomach. So those are things that are common with vaccines. And typically those things do not last, they go away. And as the speaker said, or alluded to, when you talk about the risks or the side effects of a vaccine, when you put them up against having an actual disease, there's no doubt about which one is the safer route for everyone, for that matter. Having a disease like COVID or having a virus like COVID versus taking a vaccine that's going to give you a headache and some nausea, versus a virus that could be deadly to you, particularly if you have a medical condition that leaves you immunocompromised. So these are the things that we think about. Even after a vaccine is approved as well, there are various systems that are in place to monitor vaccines, to make sure that they continue to be safe and to track any new adverse events. There's systems like one we call VAERS, the Vaccine Adverse Events Monitoring System, which is a national system that is national, that anyone can input into, and it basically tracks adverse events of new vaccines. This is new and old. There's the systems like VSafe. There's a system called VSD, Vaccine Safety Data Link, which is different health centers or different health care facilities getting together and sharing data about vaccine adverse events that have come up in their systems. And that's just a few. It goes on and on. The FDA still conducts clinical trials to make sure that vaccines remain safe even after approval. After FDA approves a vaccine, they continuously do checks with how the vaccine is manufactured. So they do checks on the facility itself and making sure that the vaccine is being produced consistently and safely in the same way. They also do checks on every single lot. So many may know that a vaccine comes with a lot number. That lot number is significant because it signifies that vaccine was made in a batch, and that batch is referred to as a lot. So the lot number is basically the batch that the vaccine that you're receiving today came from. And every single batch of an FDA approved vaccine is tested before it goes out the door to you. And so the FDA actually doesn't allow a vaccine or a batch of vaccines to go out until it's been tested. So there are many safeguards, and I could go on, but there are many safeguards in place both before a vaccine is approved and after a vaccine is approved to ensure that it is safe going into people's bodies as it is created, but also that it remains safe after it is approved.
Thank you, Louis. You mentioned the phase trials. I'm a pharmacist, so I'm familiar with the phases, but can you just give us a quick estimate of how many people are in the trials before a vaccine gets to market?
Yeah, absolutely. So phase 1 is typically the smallest phase. It's usually less than 100 people, and it's just really looking at whatever the product is, be it a vaccine in this case, is it safe to give to people? So that goes on for a few months, and then that data is collected, reviewed, and if it's seen that a vaccine in this case is safe to put in people, then they go on to phase 2. Phase 2 looks at, instead of less than 100 people, now you're looking at a few hundred people. So it's typically somewhere in the range, let's say 200 to 300 people. And so now we're looking at if a vaccine is still safe to give to people, but also now you're starting to answer some questions about the vaccine, like what the dosage would be most appropriate to be effective for most people. So once it's seen that vaccines are safe in phase 2, giving it to more people, and then you start to get more information about dosing, then you can move on to phase 3. Phase 3 is the big show. Phase 3 is when you are evaluating a vaccine in thousands of people at this point. And this is the opportunity to really see if the vaccine is effective in more of a real world setting. And so typically phase 3's trials are the most diverse trials that you have. And so you're getting a chance to begin to see how a vaccine would really play out in a real world setting. And then only once a vaccine goes through phase 3 trials and is shown to be safe and effective in a phase 3 trial, does it have the opportunity to be submitted to the FDA for approval.
Thank you so much for that. I'll come back to the vaccines. Dr. Ransom, do you have a comment?
I just want to take the opportunity to explain a question that was asked a lot during the COVID vaccines came out. They went too fast, are they safe? But I wanted to explain as a key point, a couple of things to understand. Number one, vaccines really are like a practice run for the body so that it's prepared when it's exposed to the real thing, the disease. So vaccines work by giving your body's immune system a chance to recognize part of a virus or pathogen or protein or the weakened dead one, so the body can be prepared to make antibodies. So when you're exposed to the real thing, you have a jump start on getting better. That's how they work. A lot of the side effects of vaccines are really the body's immune system responding to that stimulant in the vaccine that makes the vaccine recognize this is something bad that I don't want the body to have and prepare antibodies. And so it sort of gives it a jump start to be prepared when it is exposed to the real thing. Now what happened with COVID is because we were in the middle of a pandemic, they got the phase 1 and 2 trials. They already had been developing the kind of virus, the messenger RNA that we saw, but they had to work quickly to get it to be effective against COVID. So once the phase 3 clinical trials are the ones that involve tens of thousands of patients, most vaccine companies, it takes them years to get enough data to get that number of patients to have a statistically significant proof that the vaccine works and a potential idea of what potential side effects it has. What the government did then with the warp speed is they paid for the phase 3 clinical trials. So there were 3 huge ones involving, one of them was like 40,000, one 60,000, one 30,000 patients. So they had enough data to see that the vaccine worked and that it didn't show any signal of any very serious adverse effects. And most bad things from vaccines happen within the first 2 months after getting a vaccine. So based on all that, that's why there was really no safety steps skipped in getting the COVID vaccine approved. It was a miracle that it was done so quickly and it saved lives. So I just want people to know that that's how this worked. Instead of the vaccine companies paying for all these clinical trials, they were done all over the world in many different countries of all types of diverse backgrounds, medical conditions, ethnic groups. They really made an effort and they got the data that showed that these vaccines really looked very promising with minimal to very low side effects. So we were really lucky that it happened that quickly.
And if I could just briefly add, I just want to emphasize the point that, people don't really think about the context of COVID. You had just about every single vaccinologist, immunologist stop what they're doing and work on one virus at one time to help essentially save the world. So that's not nothing, and that's not a context that you want to just ignore. Is that the focus that we had on COVID and during that time was, tremendous, and something that I don't know if we've ever seen in our lifetimes, and I don't know if we ever will see again. Also, the fact that they can do their work with essentially unlimited resources, with the government giving folks essentially a blank check to do the research that they needed to do and move things forward as quickly as they could, still abiding by all safety regulations in all clinical trial phases and principles, but just having the resources to do that without any sort of hesitancy made a huge difference in why we got the COVID vaccine as quick as we did as well.
Thank you for that. I think that's important. At the time of COVID, I was a case manager in a doctor's office, and the doctor used to say, we're seeing science. People are not used to that. Science is not always straightforward. I was a researcher for a while. You make mistakes, you find out stuff, you rule in, you rule out. So we were actually, as a population, watching science and the vaccines. It wasn't like tetanus and diphtheria, here it is, and it's done. We were watching it being produced. So really good information. Reverend Dr. Robert Griffin, I want to come to you.
Took a fish out of water.
I know, and so that's why we like fish, and that's why we have you here on the panel. Because we did talk briefly before this about the fact of including you and why and what we're doing. So the question we have for you is, literally, we included you as a spiritual religious leader to help us understand any situations you have encountered where people may be hesitant to seek medical care, like vaccines, because of their belief system. Can you share some thoughts and experiences on that?
Thank you, and glad to be here with everyone. I'm going to do 3 points. I'm going to say true to form to a preacher. I'll give you 3 points of what I'm going to talk about real quickly here. But as I'm sitting here listening to all of this, it took me back to my childhood in Troy, Alabama, last of 14 kids. And there was a period in time when there was a chickenpox outbreak. And so what the families would do is that whichever household had the chickenpox, the kids all went to that house to be exposed to the chickenpox. And so that kind of eliminated the need for some vaccines down the road. That was good old-fashioned remedy of how you treat the chickenpox back in the day. Wouldn't do that today. And then the other part of the conversation kind of struck me, and that was kind of a faith-based thing for me also, because mother knew best, and you didn't challenge mother. That was just part of the spiritual upbringing for that. But I was listening to Lewis talking and Dr. Overy talk. When I lived in Maryland, I was stationed at the National Naval Medical Center, and I happened to be a part of two different vaccines protocols. One was the RV26 and the other one was the GB60. Both was related to HIV and AIDS, and as a clinical patient, on the other side of a different type of virus at that time, looking at HIV and AIDS, it was a unique experience to be one, having your body exposed to these various vaccines that was going into it, not contemplating the outcome, but realize that you was offering your body really to medical science, medical research, and letting people learn what they need to learn from that process. That was a very humbling process for me. That was a very spiritual process for me. And it made me appreciate the work that you folks do, to be honest, because without that type of knowledge going into these types of studies, you just can't really get to finding these vaccines as quickly as we do. And that brings me to my third point of what interesting this evening is about the spiritual context of this, is that for a lot of folks, a lot of the, and I'm just gonna, I fall more on science. I'll be honest, I'm more science than I am on faith on this, and sometimes I'm more faith than I am science, but I think it takes a mixture of both to be a part of the journeys that we're on today. And that we're not in a place where we say, I'm just gonna trust God and leave it all, and just toss up in the air and just see where it all falls. But I think because of the nuances of viruses and things that we're exposed to in 2025, that we are not exposed to things we've never been exposed to before at a level at which we've never been exposed to before, and in communities we've never been exposed to before, and in manners we've never been exposed to before. So I think that's why we need to be very cautious about how we approach these ourselves, to saying, let me examine how these vaccines benefit me as a person and what it means for me in my life versus what it might mean for faith. Faith can take us a long way, but medicine gets us the rest of the way. I'll just say, pray in one hand and have medicine in the other one. I'm gonna probably do both, but I'm gonna rely on that medicine a whole lot more to make sure that my body's taken care of, because by doing that, it also said I'm trusting the doctors. And I have faith in them that what they have been given and the years they have been studying to get us where we are today is not something that's nearsighted. So I think a part of that journey is about spiritual, it's about faith, and it's about trusting medicine. And I think that's a big part of it from the spiritual point of it.
Thank you. Dr. Brinson.
What do you say to a patient when they say, I've had patients say this to me, I don't believe in the vaccine, I don't believe in the medicine, God's gonna take care of me. I say to them, well, but God gave us brains and ability to develop ways to help each other. That's working with God,
I think it's a combination of both. When I have had people who said it to me, and one person said to me specifically, oh, I had my neighbor who took the vaccine, and then it's going to know they dropped dead in the parking lot. And I'm like, I am sure that person, 9 out of 10 did not drop dead because they took the vaccine. Some other medical thing was probably going on. I'm not a medical person, but I'm pretty sure that was not the case. And so I say to people who say, I'm afraid to take the vaccine because I don't know what's going to do, I say, you know what, here's the thing, let's find people to talk to who know. Don't trust the gossip around the water fountain. Talk to medical experts who are in the know on this and get their advice. If you don't trust or like what they say, get someone else's advice. Get informed about what's going on, especially what people wanting to do to your body around vaccines. So it's just not a one-stop shop for everyone. I think it's a multi-conversation in the community with medical professionals who know exactly what they're talking about, and getting that knowledge you need for yourself to make these informed decisions.
And I'll just add very briefly, I think my fellow panelists hit the nail on the head. I think having an ongoing conversation and not shutting people out, but giving people an opportunity to voice their concerns, voice their fears, voice whatever they've heard, whatever noise or haze. I used to tell people that during the pandemic, when we were working on developing the COVID-19 vaccines, because of the HIV Vaccine Trials Network, we kind of morphed into the COVID-19 Prevention Network. So we were helping to develop the COVID-19 vaccines. And so my job was to go out and do community education, outreach around COVID vaccines. And I would tell people, I'm not here to convince you to take a vaccine. My goal and my role is really to remove the haze around the vaccine. That haze can be fear, that haze could be, politics, it could be, just misinformation or disinformation that you receive. There's so much going on in people's lives, and there's so much noise around things like vaccines. I think that we just need to respect that, and we're also respecting folks and in terms of where they are and just dealing with medicine. You know, some people have had some rough histories with seeking medical care. Some communities have had very horrific things done to them in the process of seeking medical care. So there's a lot that goes into what makes somebody quote unquote vaccine hesitant or, you know, just fearful of taking a vaccine. And we just need to be open to having ongoing conversations with people to allow them to bring out these things and eventually get them to the place where we can have a meaningful conversation about what vaccination means for them.
One point I wanted to make, that people often make the mistake. I have patients that I've argued with over the years for the flu shot. I had a patient come in and she said, no, I'm not gonna get the flu shot because last year I got the flu shot and the next day I had the flu. I said, well, it can't happen that way. The flu shot cannot cause the flu. It's not a live virus. You probably were incubating something at the same time and you got symptoms the day after. I said, it's the same thing. Just because they happen temporarily related in time doesn't mean it's cause and effect. I said, so it could be that you got hit by a car the day after the flu shot. You're gonna tell me the flu shot caused you to get hit by the car, or you walked under a ladder or something. So people have to understand, and that's the other thing with the vaccine adverse events reporting system. It does report any kind of events that happen after vaccine, but it doesn't mean that that event was caused by the vaccine. All those reports are still evaluated by the committee looking at that, but some people go on the website and read it and they say all these people died from getting a vaccine, but it was not proven. They were just reporting things. They could have died from their aneurysm or their heart attack or something. So you have to look at everything objectively in the right way, but cause and effect is not because you're related in time. It happens, that's a temporal relationship, but it doesn't mean that the event caused, and you have to look at that.
And I just also want to invite us to take a moment to think about how these most recent things hit our community. And for a lot of us, it was a throwback to the early AIDS epidemic. There was a lot of trauma that was associated. Oh my God, we're right back there again, with stigma, with isolation, with the unknown, what's going to happen next. And so for a lot of, I've been positive since 1986. So, I tested positive in a time when it was not, and in the military at the same time, it was not a time to be user-friendly with HIV anywhere. But it was really that moment in time when we first started hearing about COVID, when we started hearing about monkeypox and all mpox, and a lot of these other viruses. For a lot, it was traumatizing. And I think some are still living through the trauma of what resurfaced for them from that experience also. And so I think as we continue to move forward with vaccines, and other vaccines that are coming down the road, is that we remind ourselves it's okay to revisit that trauma, but we don't have to stay there. It's okay to continue to be in community around these conversations because we need community to get through these things. And part of that getting through that trauma is by talking out, is by reaching out to people, by talking to people, and also again, listening to what the medical experts have to say. I'm not likely to listen to my bartender at Alibi on certain things. However, when it comes to this is one of those areas I'm very serious and compassionate about. That the best informed decision is the best way to get the exact information from the medical professionals.
Thank you all. That was a very robust discussion. I did want to come back to the basics of vaccine recommendations, and everybody has in their folder this CDC recommendation for vaccines. And it's complicated, it's color-coded, it's dependent on your age and if you have other diseases. But I wanted to ask Dr. Gorencik to review briefly, since we're all adults, we're not children in the room, some are more adult than others, what might you recommend people be aware of in this day and age with what they need vaccination-wise?
Hopefully most of you had your childhood immunizations, but it is recommended that every 10 years you get a tetanus, diphtheria, pertussis booster. That's the T, big T, little d, little a. What we forget is that with the whooping cough, that's the pertussis. The Tdap has the tetanus, the pertussis, and the diphtheria in it. Every 10 years it's recommended to get a booster to keep up your immunity. With the new vaccines that came out for pertussis, they're called acellular. They don't have the whole virus in the vaccine The original pertussis vaccines cause a lot of side effects, and children sometimes had really high fevers and even seizures from the fevers and things like that. So the new vaccines were developed, but what we learned over time is that the immunity from the pertussis vaccine doesn't last as long. So maybe it lasts about 5 years, it's already at 70%. So we're seeing more whooping cough outbreaks. My niece is in college and they had a whole whooping cough outbreak at their dorm because people aren't getting their boosters. So you have to boost your immunity every 10 years with certain vaccines, because some vaccines, immunity lasts a lifetime, like the measles vaccine, because it's a whole virus. You don't need any boosters, it lasts a lifetime. But the pertussis one, every 10 years is recommended that you get a booster. For instance, pregnant women are recommended to get the Tdap vaccine so they get antibodies to protect the babies from whooping cough. So if the mom gets the vaccine in her last trimester, she has a lot of antibodies on board that then are passed to the baby, so the baby's protected for the first 6 months of life when the baby's most vulnerable to getting whooping cough until the baby gets the vaccine series. So that's what I'm saying. So the older people over age 50, you should get the pneumonia vaccine. Pneumococcus is the most common bacteria that causes pneumonia, sinus infections. If you're over 65 and over 60 now, there's an RSV vaccine out. RSV is that virus that causes bronchiolitis in babies. So babies die every year, young babies who were born premature or whatever. And also adults over age of 65, especially if you have lung disease or heart disease, you're at risk for getting really bad infection in your lungs from RSV that can end you up in the hospital, potentially even dying. So that vaccine came out. So if you're over 60, you should get that one. Then every year we recommend the flu vaccine. That's my big peeve. The flu vaccine has really protected people from dying. Every year about 35,000 or so people in this country die from influenza. It's preventable if you get the vaccine. It does not completely prevent you from getting the disease, but it significantly prevents you from dying from it or ending up in the hospital. So the pneumonia vaccine should be given after age 50. There's a Prevnar 20 now. If you haven't had that one yet, I recommend you get that one. The shingles vaccine, the Shingrix, that's the one that helps protect you from getting shingles. The problem with shingles is that it can lead to that very debilitating pain, post-traumatic neuralgia that makes people miserable. I have to say my own poor father had that after shingles and it never left him to the day he died. He had a horrible post-traumatic neuralgia. If you get the shingles vaccine, you significantly decrease the chance of you ending up with that shingles and that horrible pain. Meningococcal vaccines is for people who are immunocompromised, you have cancer or other underlying diseases, that's 2 doses. Monkeypox vaccine you already know about, it's recommended if you're in a high-risk group or if you're going to have potential exposures, 2 doses. I did want to say the health department still has the monkeypox vaccine available. I checked with them today. They have a new place where they're giving it, and I gave that to Rob Short, so he'll send it to you. So if you haven't had it yet, I recommend you get it. It's 2 doses. That's protecting against monkeypox. And then the COVID vaccine, it is recommended, like we recommend with the flu shot every year. It looks like the COVID virus is at the point now where it's part of the community, it's endemic, it's in the background, and the viruses always have this ability to reproduce and make changes so that they change and evolve over time. So that's why we need a new virus pretty much every year now to help boost your immunity to COVID. So if you got the booster already, if you're over 65, if you have health conditions, diabetes, heart disease, if you have kidney problems, cancer, or on immunosuppressive medications, it's recommended you get a second booster in the spring. So like 3 months later, you get a second booster. Any other questions on vaccines? I'm very passionate. Everybody should get the flu shot. It really does work.
Yeah, and like I said, there is a handout in the folder that is more complicated. I will say that I went to Florida Shots and I got my vaccine record. My mother was very good. She kept all my childhood vaccines, but I've been down here for 10 years. So you can go to Florida Shots and you can request your vaccine record if you're not sure what your vaccines were. I believe, is it any doctor down here who does a shot should enter that, a vaccine should enter into? Yeah, so Florida Shots is kind of your centralized database for your personal vaccinations.
If you get vaccines from pharmacies, they all enter it into the Florida Shot.
So it's a good archive. And I thank you for the update. I had a question earlier about the COVID booster, that if you're over 65 immunocompromised and you got one in the fall, you should get another one in the spring. So there was some kind of question about that, like, oh, I heard there should be a second booster. And there is, but for certain groups. I did want to say, if anybody's watching on Facebook, if there are any questions, I don't know if we have any questions on Facebook, but we'll certainly keep that open. It's about 8, so we wanted to be out at 8:15. I wanted to open it up to the floor to see if there are any questions. I know that there was a question from Mitch. If you, let me see, what's your question?
It seems that a lot of vaccines are happening at the same time. Personally, I feel like a pincushion. I've always been concerned how they mix with each other. I might get the COVID booster, but then I might come and get the shingles, and then I got the RSV. In the trials, are they tested to see how they relate to each other? And, can you be allergic to one and not another? Does it lessen the impact of one? Should there be a time between certain vaccines you get? Because I got 3 or 4 the same day.
So there are recommendations. You can give the flu shot, the COVID shot, and the pneumonia shot all at the same time. They're not going to interact with each other. All the vaccine does, it deposits in your muscle, whatever the vaccine has, the messenger RNA for the COVID, the dead flu virus for the flu shot, and the antigens, the bacterial coats of the pneumococcal bacteria that are in the shot. So they're not going to affect each other. The body responds to all of them, so you may get sometimes more fever and achiness. Most common side effects are fever, achiness, flu-like symptoms for a day or 2 after vaccine, but they're all still effective. You can give them at the same time. Certain ones you don't give together, but those are usually recommended in the vaccine information sheets. But you can give flu, COVID, pneumonia at the same time. RSV, I would separate it, though you can give it at the same time. Shingles should be given separately, because most shingles shots cause a significant side effect. The next day people feel pretty achy, fluish, and I tell all my patients, get your first dose on a day when you know you don't have anything to do the next day that's important, so you can rest, because some people, probably about 25% have really flu-like symptoms after the shingles one. It means the body's immune system is really responding. Again, realize the response is not that the shot is making you sick, it's your immune system recognizing it and getting all geared up so that when it is exposed to the actual virus, it'll be all set to, dampen it so it doesn't cause the illness.
So for the year, what are they named for this year?
The COVID vaccine, if you haven't had it, the flu shot, the pneumonia shot, if you haven't had, that one's given every 5 to 10 years, depending. And then the RSV if you're over 60.
Rob, if I may add real quick, I apologize.
I do have thank you, the Mpox. I was probably among the first group that got the vaccine for that, because I remember that here. It was a 2-shot deal. I got one of them here, and then I had to go to the Broward Health Department for round 2. I still have the mark where they put the first shot of the Mpox. I believe they do not give it to you here at this point on your arm any longer. But shot 1, this is where they put it. Shot 2 is somewhere by the upper arm or the shoulder. This is a permanent, they told me, that will go away. I know any number of people with this permanent.
Well, yeah, the monkeypox is really the inactivated smallpox vaccine. Remember, those of you who got smallpox, you have the permanent little scar thing on your upper arm. It's just the way the vaccine works. It causes a reaction, a cutaneous reaction. But that means it works.
This is a forever reminder.
It will remind you, yeah. Those of you that got smallpox have that still in your upper arms, But remember, we eradicated a disease that was fatal, that was horrible, that was disfiguring, That's gone in this world because of vaccines. Similarly, polio is known, except there are a few pockets in the world where we're seeing polio because of vaccine hesitancy and not getting vaccines. I mean, there was a child that died up in the hospital in the north of the United States a few years ago because the family was anti-vaccine. This child died from pertussis. Could have been prevented with the vaccine. There was a patient, I'll never forget, a grandmother came to the hospital during COVID, and we asked her why she didn't get the vaccine. She said, because my daughter told me I shouldn't have it. She didn't believe in it. Her grandson came visiting her from college, and he brought COVID to her. She died from it. So this shows you some reasons why, you really should listen to people who, just make your own decision based on what your doctor tells you and what the science shows you. So many people that didn't get the vaccine, and that year of Delta was horrible. We cried all summer. The whole second floor was full of people on huge amounts of oxygen, to the point that we were meeting every morning with the state deciding which hospital needed more oxygen because we were all running out of oxygen. There were so many people on oxygen from COVID, and I tell you, the majority of those people didn't get vaccinated. We died. So.
Hi, I know there's a sheet that talks about how often you should get these, but should you be more proactive and get it more often? I mean, like the flu, should you have it several times? Would that increase your efficacy?
Just once a year is also recommended, because your body's building up immunity. The viruses change a little bit over time, so the strains that are circulating and causing flu for that year are a little bit different. So there's always 2 A strains and 1 B strain in the vaccine, and getting it every year, you're going to be good. The best time to get it is September, October, so that you're protected through the height of the flu season. Now, sometimes, like for instance, if you're going to be traveling or whatever, you want to get it sooner, that's good. You could get a second dose if you wanted to. It won't hurt you later in the year.
I did also want to ask, if somebody has had only one Mpox, monkeypox vaccination, should they, if it's been a long time, do they start over? Do they just get the second one? What's your recommendation for that?
I would probably just start over and get this, yeah.
Danny?
I've asked my doctors about RSV in particular because I've had all the other shots that have been required. I'm 77. I have a history of allergies and asthma, which right now I don't have to treat any longer. However, I've asked 3 different doctors, and they've all said there's not enough information, that the side effects are so serious, and that they only cover certain versions of RSV, and it may cover it only for 6 months or to 2 years. And so the risk of having side effects exceeds the chance that you're going to come across the kinds that are covered by the shot. So is there really good, strong data on it, or do we need to wait for more to be compiled?
Unfortunately, that's an example of bad misinformation, because it wouldn't have been approved, it didn't show efficacy data. So it's, it does show effectiveness in preventing severe disease from RSV ending up in the hospital. If you have underlying asthma or COPD, I would definitely recommend you get it. Right now it looks like you don't need another dose until maybe 2 years. It's still an evolving thing, but there is definitely, it wouldn't have been approved if there wasn't evidence that it did prevent disease, or ameliorate disease. So unfortunately, some doctors still are part of the vaccine hesitancy. I've had doctors tell patients not to get the COVID vaccine.
Just to clarify, if you got the vaccine in the fall, are you recommending we should get another one in the spring?
Is that for COVID?
Yeah, the COVID.
For COVID, yes.
Yeah. So in other words, you're recommending it every 6 months, unless you come up with something different.
Yeah,
And
if
then,
you're over 65 or immunocompromised.
And then one other thing, the monkeypox vaccine versus the smallpox. If you had the smallpox vaccine, do you need the monkeypox vaccine?
I mean, we do believe that you may have some immunity. If you're high risk for exposure, it's recommended you get the monkeypox vaccine. The one that's out now is not is less likely to cause some of the side effects as the original one, but it's effective. So definitely, if you're somebody who's at risk for getting monkeypox, if you're in a situation where you might be exposed, I would get the monkeypox vaccine.
All right, so over here.
What is the risk of?
I
guess what is the risk of becoming, it's like that bacteria in the hospital where people are resistant. So taking all these vaccines, what is the risk? Have there been studies whether or not they become just less effective when you have to start taking all these vaccines every year?
Those are two totally different things. Bacteria becoming resistant happens because we're using antibiotics so much. And bacteria, like viruses, are sloppy when they reproduce and they make mutations. And those bacteria, they have mutations that make them resistant to antibiotics, start overgrowing the more their antibiotic is exposed to them. But that's different. Vaccines, you're just helping your immune system boost it so it responds better. So, like for instance, in children, the first time they get the flu shot, they're recommended to get 2 doses a month apart to sort of rev up their immune system. After that, it's just 1 a year. So you can't hurt yet. It's a different thing. Bacteria are always smarter than us, and we find ways to get around the antibiotics. So that's why we have to be careful. That's why the doctor will tell you, if it's a cold, you don't need an antibiotic because it's a virus. The antibiotic isn't going to do anything. All it's going to do is make the next time you get a bacterial infection possibly be more resistant because you've had antibiotics for no real good reason. So they're two different things, but it's a good question.
Okay, I have friends that take vaccinations for everything. They think that they need a vaccination for everything, but when it comes to me, if the symptom, the thing that I would like, mpox, if I don't perform, I don't have like if it's a sexual thing and I'm not having sex, then why would I take the vaccination? You see what I don't know if I'm explaining it properly, but some people are just vaccination crazy, and they tell me, did you get your shot? I said, why do I need this shot?
Some vaccines are really targeted to high-risk groups, so yeah. So we know for sure that the monkeypox was spreading in areas where there was close physical contact, and you don't have closer physical contact when you're having sex. So in people who have high risk, exposed, who are having sex with multiple different people, that makes the risk higher. The more people you have sex with, the more likely you're going to be to expose. It's transmitted really mostly from contact, physical contact, skin to skin contact. It can be transmitted through sheets and things and clothes that people wear. But if you're not going out having sex, you're not going to parties, you're not mingling on people, being in close physical contact, you don't fall into the risk group, so you don't need to get it.
Is it not transmitted by air?
I was just going to echo that last part. Yes, I did curb my behavior in sexual activity, but I still don't know where I contracted mpox from. Whether it be from the air, from sharing sheets, towels, bedding, or sexual contact that I did participate in. So it did have a gestation period, so I don't know where exactly I got it. So it is important that I was a high-risk individual.
Air transmission is really not significant. It's really close physical contact, but it can stay on clothing items, sharing bed sheets. If you're sleeping with somebody and they have it, it's on the bed sheets because the lesions break off and flake off, and so the virus gets everywhere. It's only after they crust that then there's no more virus. As long as they're still wet, there's viable virus in them.
And I think it's interesting that what I understand is when HPV virus, human papillomavirus vaccine came out, there was a lot of resistance because it was for 12-year-olds or up, and it was thought to be a sexually transmitted disease. But here was a vaccine that prevented cancer. I mean, what are we doing research for if it's not something to prevent cancer, a vaccine? Who would have thought? And there was so much resistance to it. And I wonder myself, if we had an HIV vaccine, would people be resistant to it? And all the stigma around it saying, oh, I don't need that, that's for them over there.
I forgot to mention that point. The HPV vaccine is now part of pediatric recommendations. 2 doses if you give it before age 15, 3 doses if it's after age 15. It's also recommended all the way up to, I think, 40 for people who have high sexual contacts. It has been shown to significantly decrease the risk of developing these HPV-related cancers, rectal cancer, cancers of the throat. A lot of the head and neck cancers are HPV virus related. So it's really worth getting, and hopefully we're going to see an impact later down the line as more pediatricians and embrace it, but it's still, most pediatricians still have difficulty getting their parents to sometimes give that vaccine. So what we recommend is they just say this is part of what they're supposed to get now, and unless the parent objects strongly, they get the vaccine.
One more
I'll
question.
just add that there's no doubt in my mind that there would be stigma if we had an HIV vaccine. I think that's part of the reason why my role exists, is going out and trying to get ahead of basically what we saw during COVID. You know, we saw that when you don't have conversations within communities, particularly those that may have a higher level of vaccine hesitancy, even if you do have a safe and effective vaccine, there's still a lot of misinformation, there's a lot of trauma, there's a lot of medical mistrust or trauma based on medical abuse that you have to deal with. And so there's no doubt in my mind that stigma would be a huge factor in an effective HIV vaccine. And so it's something that we need to continuously talk about and continuously educate ourselves on.
Well, I do want to close it down and ask the speakers for last statements, just brief statements, and I'll start with Josh and go down the line.
I don't have anything to say. Thank you.
I said it all.
I don't have anything to say.
No, I just wanted to thank you for the opportunity to be here and speak too, because I really am passionate about vaccines. It breaks my heart to see people dying from diseases that they could have been prevented, you know, if they'd gotten the vaccine. And especially being involved in pediatrics, having seen the difference it made in pediatrics. I mean, I still can't believe that we do not see babies coming in with those diseases that I saw a lot in my training, you know, because of the vaccine coming out. So we should be grateful that we have the vaccines. They're just really tools to help protect us from diseases that have really high risk of causing significant illness and death.
Louis, any last words?
I just want to say thank you again for allowing me to be part of this conversation, and just reminding folks that at the end of the day, you are the biggest and most powerful vaccine advocate for the people in your sphere of influence. So you may have experts on panels for days and for weeks, for months, for years, but there are people in your life that are really only going to listen to you or really would be impacted by you and you bringing this knowledge to them. And so, or just remembering that, you know, vaccines are powerful tools, as my panelists said, but it takes us taking those tools and helping our friends, our family, our loved ones, understanding them to make them truly effective.
Dr. Renzer.
I just want to make one more comment because it's gotten so out of control. This whole thing with autism and measles vaccine, it's been 100% debunked. The man who did the research, Wakefield, was disbarred from the medical society because his research was not true and honest. He wanted to make a name for himself, but look what it has caused. It has caused all these anti-vaccine groups to spring up all over. There is no connection between MMR vaccine and autism. Medical societies of research should all have come out and said it, but there are people still out there, you know, propagating this. And there's a doctor out there, I think he's in Texas now, where he says, don't take the vaccines, but he sells immunostimulating things that he's making money on for people to buy instead of getting their kids vaccines that have been proven to prevent them from getting these diseases. You know, measles, 1 in 1,000 children ended up with this condition called subacute sclerosing panencephalitis, a brain inflammation, and they died years after measles. So we forget these things.
Thank you for that. I do want to thank the panelists for coming tonight, and let's round of applause. Good to see people who have given us their time.